Announcements none. Papers have been laid. Questions?
Mr. Speaker, I have submitted the following private notice question to the Honourable Minister of Health and Wellness, whether in regard to the 10 recent fatalities amongst patients undergoing dialysis at the new Suyak Hospital, as well as one other patient undergoing dialysis presently critically ill, he will state if he will order a full-fledged independent inquiry into all the circumstances surrounding same.
Mr. Speaker, sir, before replying to the PNQ, with your permission, I wish to convey my sincere condolences to the bereaved family of the 10 dialysis patients and others who have passed away during the month of March and April 2021. Chaque mort est une de trop. I make an appeal to all members of the House to show and to pay due respect to the deceased and their families. Mr. Speaker, sir, allow me to express my gratitude to all our frontliners who are working relentlessly during the COVID-19 resurgence period for the prompt and efficient management of COVID-19, thus allowing the country to curb the curve of the pandemic. Let me start at the very outset to give a broad picture of dialysis services in the public health sector. Presently, there are 1,579 patients undergoing dialysis treatment, with 1,285 patients in the government hospitals and 294 patients in the private clinics, with which my ministry has a service agreement. Transport facilities from the dialysis centers are free of charge to all dialysis patients. Dialysis patients undergo free dialysis sessions weekly as per medical prescription. Each dialysis session lasts for 3 to 4 hours. Dialysis facilities are provided free of user cost to all patients requiring the treatment. Mr. Speaker, sir, let me now come to the specific case of dialysis patient in New Suyak Hospital Dialysis Center, and to inform the House that I do not intend to order any inquiry for reasons which I will now elaborate. Mr. Speaker, sir, the dialysis unit at the New Suyak Hospital is in operation since 2012 and is equipped with 16 dialysis machines where around 90 patients undergo their dialysis treatment. The staffing as at March 2021 comprised 1 nephrologist, 1 anesthesiologist, 3 medical health officers, that is 2 at the Suyak Hospital and 1 at Tamasa Hotel, 2 anesthetic nurses, 2 ICU nurses, 1 charge nurse, 4 dialysis nurses, 7 nursing officers, 3 healthcare assistants, and 3 attendants. I wish to point out that all the above personnel are specialists in their respective field and undergo regular training through continuous medical education and are fully committed to their duties, especially in those difficult and special circumstances where they have had to leave their respective families for weeks to cater for the needs of the dialysis patients. The staff I have referred to work as a team for the betterment of the dialysis patients and devote their whole time to these patients in accordance with evidence-based international guidelines. Mr. Speaker, sir, during the outbreak of COVID-19 at the dialysis unit at the New Suyak Hospital, a total of 87 patients were undergoing dialysis at this unit, and 3 patients were admitted at Jawaharlal Nehru Hospital for other medical problems. On Friday, 26 March 2021, it was reported that the PCR test done on the eve of 1 female nursing officer posted at the dialysis unit at the Suyak Hospital was positive. The public health measures, as per the established protocol, were enforced. Concurrently, appropriate measures were taken to ensure the continuity of medical care and treatment of all our patients. On the same day, as soon as the above report was received, all staff members working in the dialysis unit were isolated and had their PCR test done. Following the screening, 7 staff members were found to be positive for COVID-19, namely 2 doctors, 1 charge nurse, 3 nursing officers, and 1 attendant. The above staff who were positive were admitted at ENT hospital. Mr. Speaker, sir, on that day, that is on 26 March, dialysis patients were therefore not conveyed in our transport from their residence to the dialysis unit for their treatment. However, 6 patients came to the New Suyak Hospital by their own means. PCR tests were done for those 6 patients, out of whom 3 were COVID positive, and they were admitted at ENT hospital on 26 March for treatment, and the remaining 3 who were COVID negative were quarantined at Tamasa Hotel. All other dialysis patients undergoing treatment at New Suyak Hospital were also quarantined in Tamasa Hotel. Patients in quarantine at Tamasa Hotel who requested for their relatives to stay with them as companions were given the permission to do so, provided they accepted to sign an undertaking form. There were 14 relatives who stayed with their respective patients. It is to be noted that the cost of the room for single patient is 32,000 rupees for 14 days of quarantine, and cost of the room for room shared with relative is 54,000 for the 14 days of quarantine. Mr. Speaker, sir, I wish to inform the House that Mauritius is one of the rare countries which isolates all COVID patients. In most countries in Europe and in America, there have been numerous outbreaks of COVID-19 in dialysis units. There has been no attempt to isolate these patients in quarantine centers. Patients are self-isolated at home and travel to and from the dialysis center by organized transport. Hence, there is a high risk of further spread of infection to the rest of the community in these countries. In Mauritius, in order to protect the community, the protocol is to quarantine all contacts of COVID-19 cases and to isolate all COVID-19 cases in a treatment center. This applies to dialysis patients also. All standards regarding dialysis treatment have been adopted and maintained. All dialysis patients continue hemodialysis at the same original center so as to minimize the risk of contamination to other centers. Mr. Speaker, sir, the whole of the New Suyak Hospital, including the dialysis unit, was closed in order to allow for complete disinfection to be carried out over 24 hours, as from Saturday 27th to Sunday 28th March, and all dialysis treatment were rescheduled accordingly. Concurrently, all other dialysis patients of New Suyak Hospital were screened, and 12 were found COVID positive on 28 March, making a total of 15 patients, COVID patients, positive. All positive patients who were admitted at ENT hospital were sent back to the isolation ward at Suyak Hospital for treatment and to continue their dialysis sessions at the above hospital as from March 28 in the afternoon. From 26 March, that is the day 0, to 9th April, that is day 14, which corresponds to the incubation period, as from the first detected case of COVID-19, 39 COVID-positive patients were admitted at New Suyak Hospital. 1 additional patient was tested.
The Speaker, last week, Honourable Minister gave all this information last session. The question is specific about a much-needed independent inquiry. There are people dying at the moment, as we speak, or critically ill. I would expect the minister to have some respect for these people and to address the question, not give us information that is already given last session, Mr. Speaker. Time is running out.
Let's hear the minister.
Mr. Speaker, this question is addressed to all those patients. We have to give this information. At no point in time last week, I've given the detail. I'm answering a PNQ. The public should be made aware of all the facilities, all the treatment that have been provided to all these patients. I will continue, Mr. Speaker, sir.
I'm given
Unfortunately,
the nature of this question, the very solemn nature of this question, that you will give additional time.
Mr. Speaker, sir, I'll continue. Unfortunately, of those COVID-positive dialysis patients, 3 passed away, 1 passed away on 9th of April, 2 passed away on 11th of April due to COVID. 4 COVID-positive dialysis patients passed away on 29th, 31st March, 29th March, 31st March, 5th April, and 11th April, and were declared dead with other comorbidities as cause of death, that is ischemic heart disease, chronic renal failure, cardiac arrhythmia, chronic renal failure as primary cause of death, respectively. Another patient passed away last night, that is on 19th April, at New York Hospital with cerebrovascular accident as the cause of death. Mr. Speaker, sir, 2 negative COVID patients who were in quarantine in Tamasa Hotel passed away. 1 patient passed away on 29th March due to chronic renal failure, and the other one passed away on 7th April due to cardiac complications. On 4th April, 2 dialysis patients at Tamasa Hotel were confirmed COVID positive and were admitted at Suyak Hospital, followed by 2 more dialysis patients on 9th and 1 more on 11th April, who were also confirmed COVID patients. As of date, there are 31 COVID-positive patients at New Suyak Hospital. All the COVID-negative dialysis patients have been discharged from Tamasa Hotel, and 10 dialysis patients have passed away, out of whom 2 were COVID-negative. 3 patients passed away due to COVID, and 5 COVID-positive patients passed away due to other comorbidities. Mr. Speaker, sir, as regard to the medical coverage, the 3 doctors were posted at the quarantine center to look after all patients in quarantine at Tamasa Hotel. 1 doctor accompanied the patient for their dialysis sessions at New Suyak Hospital on a daily basis.
It is all given last week. I can tell you 1 nephrologist, 2 other doctors, they accompanied the persons to and from. All this was given last week, last session, Mr. Speaker.
But you know, I have no
Mr. Speaker, sir, I'm answering to this question. And all the information I'm giving is related to this PNQ. I'm not going out of subject. 4 more doctors, including 1 nephrologist, 1 anesthesiologist, and 2 medical health officers were posted at New Suyak Hospital to look after patients who were PCR positive and who also required dialysis treatment. In addition, 6 experienced dialysis nursing officers who were called from other dialysis units of different hospitals were posted at Tamasa Hotel Quarantine Center to look after the dialysis patient and also to provide their dialysis treatment sessions at Suyak Hospital. 6 more nursing officers were posted at the New Suyak Hospital to look after the patients who were COVID positive and also to provide their dialysis sessions at later hours. During the late hours session, 2 additional dialysis nurses were posted to look specifically after the COVID positive patients. Arrangements were made for all patients to have their dialysis sessions at Suyak Hospital. Moreover, 2 imaging technologists and 11 hospital attendants were posted thereat to provide support services. It is to be noted that these staff members had to stay on a roster at the hospital during a period of 1 week, after which another team took over. All patients tested positive negative and undergo earlier dialysis treatment scheduled between 7 hours to 20 hours, and those patients who are positive for COVID are having their treatment at later hours, that is after 21 hours. The staff were fully equipped with personal protective equipment, which were renewed after each dialysis session. Mr. Speaker, sir, as regard to the diet for the patient in quarantine center, it was reported by some patients that on the first day of quarantine, they did not have an appropriate diet according to the medical condition. Arrangements were made for one dietitian of my ministry to advise daily on the diet for the renal patients so as to cater the patients at Tamasa Hotel. All protocols for cleaning and disinfection of the whole units, as well as the dialysis equipment, were done in between each dialysis session with appropriate and recommended disinfectant to prevent the spread of the virus. All consumables used for each dialysis session for each patient were disposable once for single use and only for one-time use. Mr. Speaker, sir, cleaning and disinfection of dialysis units and equipment are done in accordance to strict protocol, which includes the following: cleaning the floor with sodium hypochlorite solution. The dialysis machine are equipped with auto disinfection program, which is mandatory and is done after each dialysis treatment with sterilizing solution. Hot auto disinfection is also done on daily basis using recommended sterilizing solution. Surface cleaning of the dialysis machine and other equipment is done by usual special solution. Fumigation of the room is being done daily at night after all sessions are completed. Furthermore, all staff and patients are always instructed to abide to all sanitary precautions. Mr. Speaker, sir, I will now come to the transport arrangement made for the conveyance of dialysis patients, stressing on the fact that Mauritius is one of the very rare countries providing such dialysis facilities to its dialysis patients from their residence to the dialysis centers and back. From 28th March 2021 to 11th April, 2 15-seater vans and 1 ambulance were posted at New Suyak Hospital for the conveyance of dialysis patients. For each session, 13 patients could undergo dialysis treatment. Each 15-seater van was conveying 6 patients at a time, so as to cater for physical distancing during the trip from Tamasa Hotel to Suyak Hospital and back. The dedicated vehicles conveying staff and patients from Tamasa Hotel to New Suyak Hospital and back were equipped with a transparent plastic screen to separate the drivers from the passengers. For the period 12th April to 17th April 2021, the number of transport for dialysis patients was increased to 4, with 1 additional 15-seater van. Mr. Speaker, sir, our doctors are keeping themselves abreast of the evolution and scientific evidence since the beginning of the pandemic, in line with good medical practice. The nephrologists are kept updated on the scientific developments in the field of nephrology in relation to COVID-19. Specific treatment protocols have been elaborated for the care and management of dialysis patients well before the resurgence of COVID-19. Literature reviews show that the prognosis of dialysis patients infected with COVID-19 is unfortunately very poor. Depending on various studies, the mortality rate is 20 to 35%. For instance, a large multicentric study published by Journal of American Medical Association based on 65 dialysis centers show a mortality rate of 34.5%. In Australia, where a stringent quarantine protocol applies, there have been 7 fatalities out of 13 dialysis patients infected with COVID-19. Similarly, in the UK, out of 6,488 COVID-positive dialysis patients, 1,338 have passed away. Mr. Speaker, sir, I would have preferred not to draw such comparisons, but we know the schemes of the opposition. Mr. Speaker, sir, Having said so, these figures refer to human beings, and behind every statistics, there is a person and a life that matters. The fight goes on, and our aim remains to save every single life. Hence, Mr. Speaker, sir, I do not intend to carry out any inquiry.
Mr. Speaker, sir, at the start, I would like to offer my sincere condolences to all the deaths and the people who have suffered, people who died, recognize the efforts of the staff, but I will also say, Mr. Speaker, I consider it my moral duty that light be shed on the deaths of these 10 persons and the people who are critically ill at this moment. I will start, Mr. Speaker, by tabling a copy of a report published in the Lancet, which shows that Mauritius is the worst country in the world, with the highest death rate for kidney disease in the whole world. I will table that, Mr. Speaker, as to show that there should be no room for self-satisfaction. I will ask the first question, Mr. Speaker, concerning vaccines. 424,000 vaccines had been received by the time of the outbreak in New Suyak Hospital. Yet not one single person at that hospital for the dialysis had been vaccinated. And I will refer, Mr. Speaker, to what he said in his PNQ, that the Minister said in his PNQ of 23rd March, the vaccination programs for senior citizens and patients with comorbidities was put on hold, was stopped, and the vaccination program was targeted to persons with work access permits. Therefore, I ask Mr. Speaker, who and why were instructions given to stop vaccinating these highly fragile persons? Why, against, Mr. Speaker, WHO guidelines of 13th November 2020? Who and why were these instructions given, Mr. Speaker?
Mr. Speaker, sir, I'll first come up with the first information that the leader of opposition has said, that he has shown a document from Lancet. Mr. Speaker, sir, in our country, all patients who had a kidney problem is given the possibility, the chance of having dialysis at all costs. In other countries, it's a selected group of people that is given the chance to do dialysis. Mr. Speaker, sir, let me explain. In other countries, those patients who will get a donation, a renal donation, they will be given the chance to do dialysis. Secondly, Mr. Speaker, sir, concerning the vaccination program. Yes, the ministry, the government has decided to give vaccination for comorbidities as a priority. But at the same time, we had the confinement. During the confinement, what is our advice? Our advice is to protect people, to protect those people who are vulnerable. They should not be allowed to move out. This is the protection we have given. Secondly, Mr. Speaker, sir, for the vaccination, the ministry has already in the beginning offered the chance for all cardiac patients and dialysis patients to get vaccination. But the vaccination program is a voluntary one. It's a voluntary program. We can't force people to get the vaccination. Now, Mr. Speaker, sir, thirdly, a vaccine doesn't act immediately. It takes 4 weeks to develop the antibodies. Now, Mr. Speaker, sir, I also wish to highlight the House that 63% of our patients have been vaccinated. Acceptance was low in the beginning, and even some refused to do the vaccination.
Mr. Speaker, no serious effort was made by the ministry to vaccinate, hence zero vaccination at New Suyak Hospital. He stopped it and started again in confinement because he knew it was a disastrous policy to stop. Mr. Speaker, I'll ask now about healthcare workers. Dr. Musango, bless him, of WHO, said in October 2020 the infection rate amongst health workers is very high. You have to be careful in case of resurgence of COVID. Why was there no routine PCR test done with any of the health workers working at the hospitals in Mauritius, especially the new Suyak hospital? And this lady, Mrs. Sanasi, she went of her own volition, not feeling well, to get a test. This was not a routine or even a procedure by the Ministry of Health. Why were you negligent in that way?
Mr. Speaker, sir, I'll first come up for Suyak Hospital. At a time when you have personnel have been infected, they all have to move in quarantine as our established protocol. And in quarantine, we can't do vaccination. Similarly for the patients. All patients, whether they are tested positive, they are in treatment centers, or they are not tested positive, they are in quarantine. So they have those who are in quarantine or suspect cases. We can't do vaccination at this point. This is the expert advice. At the same time, when Dr. Musambo said the infection rate from that time in October was very high, no recommendation was given that the PCR test should have been done routinely on the staff of the hospital. The leader of opposition is getting it very wrong. Mr. Speaker, sir, the first and the most precaution that should be taken is wearing the mask. Wearing the mask is the most important and not the PCR test. Even if you do the PCR test at this time, the PCR test will give you an information for the past. But what is more important is how you put in place the barrier measures, how you use the mask, how you do sanitization. This is most important.
No,
Mr.
you
Speaker,
don't have
sir,
the flow. You don't have the flow. As simple as that. Please, quiet. Quiet.
Mr.
Continue,
Speaker,
Minister.
sir, this is a recommendation that all health personnel, even all the public in general, including the honorable leader, they have to use. It's not the test that is the first, the primordial, it is the barrier method.
It's okay now. We've understood your meddling. Mr. Speaker, why then on the 29th of March, he has issued himself, signatures could have issued a circular to all hospitals to ask them to have routine PCR tests. C'est la mort après la tisane, Mr. Speaker. This is the whole point.
Put your question.
And he's trying, Mr. Speaker.
No.
I'm
no
very
debate.
okay.
Put your question. You must
Why
be
is the minister fiddling the issue when he's talking about vaccines? I am talking about vaccination before the pandemic at New Suyak Hospital. That is when he did not vaccine one single person there. I'm asking why. Don't answer me.
Okay, no comment.
Okay.
Why?
Mr. Speaker,
Okay, sorry.
I'll come back with the PCR test. Obviously, when in three of our institutions we have doctors, we have personnel that have been infected, it's important at this time to do routine tests. And again, in the future, it's not only routine tests that have to be done.
This is threatening. I'm just advising. This is threatening. Mind well. Nobody should talk if he doesn't have the floor. This is standing order. I show it to the population, to the chamber and the population.
Mr. Speaker, sir, Honorable Mohammed used to poke in between whenever there is a question from the Honorable Leader of Opposition. Mr. Speaker, he should be taken to task because he can't be. He's been doing that for months. We've been watching her. And this is the word.
Order! Order! Order!
I will answer my questions.
Order!
But-
There is only one leader of the opposition.
Honorable
There was
members,
another one, he's not here.
I'd like to ask the Honourable Minister, this is what has shocked independent nephrologists most of all, is that 2 patients died at Tamasa Hotel just after having their dialysis sessions, Mr. Speaker. And this reminds me of what one Mr. Honorable Ivan Kolamadu said in the paper on 10th April 2021, sir. He said, Jimoun, Papumo, or COVID, mais or mauvais dialyse. Here I am asking the Honorable Minister, why has he had an inquiry to see why 2 people, otherwise healthy people, died under his watch?
You made your point.
Just after the dialysis session.
Let him give the reply.
Mr. Speaker, sir, I'll again come up with the question that was put to me about the dialysis patients. Have they been vaccinated? 7 patients from Suyak Hospital went for vaccination before the outbreak on their own because this was what was issued from the ministry, that patients, dialysis patients and cancer patients have to be vaccinated. But vaccination is a voluntary element. And we have to understand that patient has been doing it on voluntary purpose. Now, secondly, about what the leader of opposition has said on the 2 patients who have passed away. Mr. Speaker, sir, this is not time for me to give all the details of those patients. Mr. Speaker, sir, I rely on the doctors who have been treating these patients. I rely on the nurses, on the health professionals who have been treating these patients. Before coming to dialysis, most of the patients has a long history of medical illness. And these doctors, these nurses, they know their patients very well. They know who are very critical, who are very vulnerable, and they know what they have been doing for these patients. I'm not going to comment because this is very sensitive issues for those patients. I have all the respect for those patients. We are not going to have a discussion on the mode of how was the death happen, but at the same time, it is very shocking, Mr. Speaker, sir, that people die before, after, and during dialysis, and unfortunately, this has become the debate of the day. This is what I wish to say, but Mr. Speaker, sir, rest assured that the ministry has taken all the information about those patients. We have studied it. The doctors have seen whether the proper treatment were given to those patients who have passed away in the dialysis, in the quarantine centers, and we are all satisfied that those patients, whoever, wherever, in whatever condition they have passed away, we have seen that the doctors, the personnel who have been doing their job, they've done a fantastic job.
The Minister has not listened at all to what the people in Tamasa have said. Nevertheless, I will come back to it in the press conference. I would like to ask the Minister concerning his statement that he will not have any medical inquiry. Let me ask him whether he is aware that one family has already submitted a complaint for medical negligence during the weekend. Whether he is aware of that, stating the basis for the complaint, whether he's aware of that, and whether he's also going to ignore this family's complaint.
Mr. Speaker, sir, the Ministry of Health receives every month more than 2 to 3 complaints. And these complaints, there is a procedure. The procedure is the Ministry of Health receives the complaint. First is wherever this patient being treated in the regional hospital, there is an internal inquiry. The report are sent to the ministry. The ministry will send this report to an independent inquiry, that is the Medical Negligence Standing Committee, chaired by an independent person with all the 3 doctors who are involved into that. They will do their inquiry. They'll come in a report. The ministry will rely on the recommendation of the report. This is how the Medical Negligence Committee work, and all the alleged negligence or all the complaints are treated in the same way. We have been, and after that, the report will be referred to the Medical Council for another investigation, and if there need be, the Medical Tribunal also will conduct an independent report, an independent inquiry. These are the procedures, Mr. Speaker, sir. We are only following the procedures. All patients who are having a complaint will not come to the minister. We'll follow the procedures. and procedures, whether it should not come to my office, because this is for the proper governance. The complaint should be dealt with the officer responsible. It's not that the minister should interfere into an inquiry. This should be the answer that I wish to give.
Table copy of the letter with the permission of the family, copy of the letter of complaint. And I must say I'm not surprised that the minister doesn't agree to an inquiry on himself, on his own incompetence. So, Mr. Speaker, I will now come, and this is why I wanted to ask a question to your boss.
Mr. Speaker,
now,
sir,
Mr. Speaker, as far as psychological torture is concerned, Mr. Speaker, he gave the impression that from the first day everything was fine. In fact, it took 6 days, up to April 2nd. I think there were some interventions by his colleague for him to realize the dramatic situation at Amasa. Let me say, Mr. Speaker, sir, psychological torture. People were put by themselves for the first 6 days.
Question about that.
Let me say whether he's aware of it. Is he aware that people were there 6 days without TV? And in fact, not 6 days, the whole time, without TV, without phone line, without internet. And the first 6 days, no possibility of being accompanied by anyone. And they needed the support of their loved ones. And so many people died, Mr. Speaker.
Mr. Speaker, sir, quarantine period is not difficult for one, it's a difficult time for everyone. But we have to safeguard life of others. These are public measures. Mr. Speaker, sir, let me remind Honorable Leader of Opposition that in the beginning, when we first have passengers to be quarantined, at that time, we did not have a single hotel. At that time, we managed by the buildings provided by the Ministry of Social Security. We managed to keep Mauritius safe by using all our means to get it. It's at a later stage that we start having hotels. Mr. Speaker, sir, for quarantine, for me, for himself, is a difficult period to stay 14 days in a room. I understand this. But at the same time, why are we doing this? It's only to save the life of the person who's been quarantined, not to make him infect others, and at the same time protect the families. We are doing everything in terms of accommodation, in terms of facilities being given at the quarantine centers. But Mr. Speaker, sir, with all that we've been doing, we have been to all the quarantine officers, all the staff working in those centers, they've been up to the level because they have been delivering, and that's thanks to them that we've been able today to keep people in quarantine, and that has helped us to curb the curve, that have helped us. Today, 1 month back, we have a number of cases in the local community. And these are the procedures that we should highlight, that we should do. We should make people aware of why we've been doing quarantine. I understand it's a huge psychological impact, but we have to go through that. And this is the only way. By doing so, we've been able to curb the curve. We've been able, for the last 1 week, to have hardly 1 or 2 cases in the population.
Mr. Speaker, locking people up by themselves in a room, 24 hours, without TV, without internet, without a telephone line, is doing everything, Mr. Speaker. Not at all. Mr. Speaker, I'd like to ask the Honourable Minister about contagion.
Order.
He's doing everything about contagion.
Time is almost over. Put your question. Put your question.
I'm putting my question, Mr. Speaker. This morning, there's an article in the paper to show that the procedure at the new Suyak hospital, as far as dialysis, is being completely changed, après la mort l'artisan, with separate machines for positive and for negative patients. Mr. Speaker, it is clear that these persons were in perfectly good health. Fathers, mothers, grandmothers, wives, husbands, breadwinners. And they came and they were quarantined or they were put at the hospital and they found their death, Mr. Speaker, sir. So I'd like to ask the Honourable Minister, why is it that so long after they caught the virus at the hospital, now only, he is realizing that there should be social distancing, that there should be cleaning, perspex, etc. I'm going to table, Mr. Speaker. I'm going to show.
Don't make any
I'm going
debate.
to
Put
show
your question.
a
Time
picture,
is over
Mr.
by
Speaker,
almost 10
of the
minutes.
van where there was absolutely no social distancing on the 29th of March. Why is it only now, Mr. Speaker?
Okay.
Mr. Speaker, sir, I'll come back with the question of lockdown. We've locked down people in the quarantine centers. Mr. Speaker, sir, these quarantine centers, why do we quarantine? If we have to allow everybody in a quarantine center, there might be more than 300 persons who are quarantined. So we let everybody mix with each other. Mr. Speaker, sir, let me reply.
Leader of the opposition.
Mr. Speaker, sir,
Honorable Leader of the opposition.
he is refusing
This
to...
is interrupting.
Mr. Speaker, sir,
Order.
why should we have a quarantine if we have to allow everybody to move?
No cross-talking. What is happening here?
And again,
You are doing that. You are throwing the paper. Please. You don't have the floor. Time is over. Prime Minister, question time.
La séance de la PNQ très animée ce matin, un sujet très important, très sensible, le décès de 10 patients de dialyse. Et là, le leader de l'opposition vient avec un feu roulant de questions par rapport à Samankala. Alors d'abord, le ministre de la Santé fin dire qui pas pour aucune enquête la mort sa 10 patients de dialyse là. Le ministre Diakatpal fin énumère une série de mesures qui, d'après lui, ce ministère fin prend pour protéger certains patients de dialyse là. Donc, il dit qu'il reconnaît qu'il premier jour en quarantaine tient un problème, tient un issue de nourriture. Il dit que le ministère vient faire arrangement pour dépêcher un nutritionniste sur place. Il dit qu'il fait fumigation dans la salle de dialyse, qu'il stérilise l'appareil de dialyse. Il dit que Maurice est un de mes rares pays qui offre un service de transport à un patient pour faire une session de dialyse. Il dit qu'il met à disposition une van de 15 places et 6 patients seulement donc à time, donc par voyage, 6 patients qui allent dans sa van de 15 places là. Il y a aussi service l'ambulance. Et donc plusieurs mesures qui, d'après le ministre Diakatpal, ce ministère prend pour prothèse et pour qui une session de dialyse de patient là faire dans les meilleures conditions possibles. Mais dans la tranche de questions supplémentaires, Xavier Duval vient plusieurs points spécifiques. D'abord, leader de l'opposition reconnaît les efforts que le staff médical faire, mais il dit qu'il est trop grave, 10 patients de dialyse mort, il dit besoin faire une enquête. L'IN dépose copie un rapport sur la table de l'Assemblée nationale, que d'après lui, ce rapport-là démontrait que Maurice, c'est parmi les pays que le taux de mort, de décès, de fatalité, parmi les patients qui ont une insuffisance rénale, les parmi les plus élevés dans le monde, d'après ce rapport que le leader de l'opposition fin mentionné là. Mais le point le plus important de Xavier Duval, il dit que dans unité dialyse dans l'hôpital Souillac, il y a un dimoun qui s'y fait un vaccin. Et c'est là qu'il attaque la politique du ministère de la Santé, il dit qu'il fait pas une priorité ben dimoun qui est vulnérable. Vieux dimoun et ben dimoun qui a un problème cardiaque, problème les reins, qui fait pas une autre priorité en termes de vaccination et puis donne plutôt priorité à un moment donné à un détenteur de WAP. Et il dit que c'est une politique désastreuse, puis il y a un dimoun dans l'hôpital Souillac qui finit faire un vaccin. Ministre Diakatpal répond, dit que pendant le confinement, il dit un dimoun qui est fragile, qui est vulnérable, ça ben dimoun là, qui besoin reste la case. Sauf que un patient dialyse, vous n'êtes pas capable reste la case 24/7, vous êtes obligé de sortir pour aller faire une session de dialyse. Le ministre Diakatpal dit que le vaccin est volontaire. Et il dit que le vaccin n'est pas agir tout de suite. Et il dit que 63% des patients sont vaccinés, mais au départ, beaucoup sont réticents pour faire le vaccin. Et donc, comme il dit, le vaccin n'est pas obligatoire, pas capable d'obliger les gens de faire le vaccin. Leader de l'opposition fait une cite Laurent Moussango, qui est représentant de l'OMS à Maurice. D'après lui, en octobre 2020, Laurent Moussango tire la sonnette d'alarme, attire l'attention pour dire qu'il le risque de contamination parmi le staff médical est élevé. Vous avez dû dire t'es ciblé à staff médical. Le ministre Diakapa, lui répond, il dit que c'est pas test PCR qui est plus important, il dit staff médical plus un porte masque. Alors, est-ce qu'il maintenant il peut insinuer que certains staff médical pas fin pour d'autres masques, mais il dit que porte le masque est beaucoup plus important que test PCR. Et il dit, mais Xavier Duval reprend l'île là, Xavier Duval dit qu'il fait donc le 29 mars, ce ministère de la Santé, émet un circulaire à l'hôpital pour demander aux autres faire test PCR à le staff médical. Donc, il dit, which is which. Xavier Duval finit aussi affirmer que des patients, parmi les patients qui sont décédés, dès là-dedans, finalement, 10 après cette session de dialyse. Il dit, il n'est pas normal, il dit, la vie, ça va dire, tu es capable d'être sauvé. Les sites Ivan Colin Davelou, qui se dit, d'ailleurs, il dit ça à Radio Plus, qui, c'est pas Covid qui pour tout le monde pour mot en mauvais dialyse. Il cite donc cette déclaration de Ivan Colin Davelou. Et Xavier Duval dit que pendant le week-end, une famille fin porte plainte pour négligence médicale. Donc, une famille de sa même patient qui fin décédé là, fin porte plainte. Parce que initialement, le ministre dit qu'il n'a pas pendant l'enquête parce qu'il n'y a aucune allégation, aucune plainte pour négligence médicale. Maintenant, Xavier Duval peut dire qu'il finit une plainte pendant le week-end de la part d'une famille. Le ministre Diagatpal finit dire qu'il poursuivre une procédure au niveau de ça, l'enquête-là. Le leader de l'opposition finit aussi évoque ce qu'il appelle la torture morale, mentale de sa patient dialyse qui tient en quarantaine là. Il dit pendant 6 jours, je finirai dans la SAM. Pendant 24 heures, pas de télévision, pas Internet. Et le ministre Diagatpal répond qu'à ce moment-là, il est difficile pour gagner une infrastructure nécessaire pour mettre tout ça du monde là en quarantaine. Xavier Duval dit, après la mort, la tisane, il dit maintenant dans l'hôpital Souillac, permettre une machine pour permettre une session de dialyse séparément pour du monde qui est négatif à la COVID et pour du monde qui est positif à la COVID. Il dit maintenant, après la mort, la tisane, si tu fais ça au départ, la vie est capable d'être sauvée. Voilà, Jagdish, un PNQ très important avec une question, à mon avis, très pertinente du leader de l'opposition. Et Xavier Duval maintenir qui s'amène la vie d'être capable d'être sauvé.
Alors, donc, Xavier Duval fait lier cette question pour une enquête indépendante avec la négligence médicale alléguée ou un manque de protection, surtout l'une ciblée sa malade qui peut suivre une session de dialyse. Et là, le ministre peut dire qu'il fait pas pour faire une enquête indépendante et approfondie, parce que tous les mois, il y a 2 ou 3 complaintes de négligence médicale qui déposées donc avec le ministère de la Santé. Et là, il explique la procédure. Il y a ce qu'il appelle une enquête interne, internal inquiry. Ensuite, il y a le Medical Negligence Standing Committee qui joignent pour guetter si vraiment il y a négligence. Le rapport déposé, donc soumet au ministère de la Santé et le ministre ensuite décider si besoin il y a un Medical Tribunal. Mais Xavier Duval, il dépose rapport qui fait mention, il mentionne surtout le magazine Lancet, qui est un magazine très connu sur le plan médical mondial également. Donc, c'est une référence mondiale et concernant le service de la santé dans le monde, manière évolution, une maladie était telle affaire. Alors, donc, Xavier Duval peut montrer qu'il malgré tout ça, une disposition qui est là pour l'enquête, ici, dans mon cas précis, il est nécessaire de situer responsabilité pour connaître si finalement une certaine laisser-aller qui fait après 6 jours que le ministère de la Santé il prend conscience, bien mettre en place une disposition beaucoup plus organisée, plus professionnelle sur le plan sanitaire, sur le plan médical en faveur de ces malades-là. Également, la question de transport, là, il fait une photo pour montrer dans une vanne, par exemple, le nombre de malades qui peut transporter.
Pas social distancing.
Le social distancing. Et le ministre de la Santé, au départ, avant, il fait dire que même si le test PCR n'est pas important, c'est le social distancing, c'est-à-dire le port du masque, le plus important donc qui a le faire un test PCR parce qu'il a d'abord la protection du malade lui-même, également la protection de ce voisinage. Également, fin soumettre Mansif Nawaz, donc nous avons 1579 patients qui peuvent suivre une session de dialyse, 1285 dans l'hôpital, dans le service médical donc du gouvernement public et 294 dans une clinique privée. Alors l'hôpital de Souillac également, et donc Xavier Duval fit montrer, c'est-à-dire comment ma disposition partie est bien appropriée pour ces malades-là. Mais le ministre peut maintenir que toute bonne disposition en 24 heures il prend pour désinfecter l'hôpital, également donc une disposition qui le personnel médical fin prend pour traiter les malades. Le ministre de la Santé peut dire un hommage au travail qu'il peut faire. Xavier Duval, d'accord, que oui, il y a un gros travail peut faire par le personnel médical, mais seulement tout bon moyen disponible qui est nécessaire pour protection, surtout les dialysés, d'après Xavier Duval. Donc, ça va un critère-là, pas fin répondre de manière positive et favorable.
Voilà, Jagdish, en tout cas, donc bien triste, ça 10 patients de dialyse qui ont perdu la vie. C'est à mon avis, une très bonne PNQ du leader de l'opposition. Bon, maintenant, les 10 personnes ont perdu la vie et pas pour l'enquête, d'après le ministre. Maintenant, il y a une plainte pour négligence médicale, donc ça, c'est un cas.
Oui,
mais pas pour l'enquête, une full-fledged independent inquiry, la mot, ça a 10 personnes là.
Moi, mon pensée,
à mon avis, Jagdish, cette demande d'instituer une enquête indépendante, à mon avis, c'est une demande légitime.
Oui, elle est très appropriée pour situer la responsabilité, parce que nous gagnons l'impression que le ministère de la Santé il tient une leçon après qu'il y a un premier cas d'infection qui commence à lever, et ensuite, à partir d'une première victime. Donc, c'est certain de ces malades-là. Maintenant, d'après le ministère de la Santé...
C'est vrai que le ministère de la Santé finit pris au dépourvu. Nous rappelle, Jagdish, c'était un vendredi, nous avons fait l'émission Cœur de l'info, le ministre Diagatpal a annoncé que l'hôpital Souillac est un cluster et que plusieurs patients de dialyse finissent placés en quarantaine. Après, nous apprenons que les patients-là finissent, une bonne partie là-dedans finissent contaminés, finissent COVID-19. C'est vrai que tout le monde a été pris au dépourvu par ce qui est arrivé. Bon, maintenant, là aussi, il y a différentes écoles de pensée. Donc, il y a du monde pour dire que le gouverner, c'est prévoir. C'est bien capable, finir, faire provision et bien expect the unexpected. Bon, cela dit, du moment qu'il arrive ça, le staff médical finit pris au dépourvu et finit arrive ce qui finit arrive. Mais comment on peut dire, Jagdish? Il ne faudrait pas qu'il l'amour, ça 10 du monde là, en 20. Une enquête indépendante qui peut permettre de faire une recommandation. D'abord, situer les responsabilités.
Oui.
Situer les responsabilités et ceux qui ont fauté, bien être sanctionnés. Ne pas faire compromis là. Parce que 10 mots. Mais également, ce qui est important avec une enquête comme ça, appeler un fact-finding committee, whatever, il y a avec une recommandation pour qu'il prochaine fois, gagne un cas comme ça, qui arrivait si l'hôpital vient un cluster de Covid.
Pour l'avenir.
Pour l'avenir. Il arrive ça dans une dialyse. Qui arrivait si c'était dans Cardiac Unit, l'hôpital Candos. Qui arrivait si c'était dans Cardiac Center Pamplemousse. Qui arrivait si ça capable d'arriver à une autre place, si demain une troisième vague. Oui. Donc, il est très important qu'il nous tire une leçon. le ministre, le problème, c'est que le ministre, il n'est pas capable, il n'est pas capable de faire ça l'enquête-là. Parce qu'il lui-même, il n'est pas capable de juger une partie là. Il y a besoin de monde qui est totalement indépendant, situé responsabilité, parce que la responsabilité du ministère de la Santé pour être également passée sous supervision.
Oui,
pour bien guetter si, sous la loupe, pour bien guetter si, pour bien guetter si ce ministère, si responsabilité ministère lui-même, l'est engagé dans la gestion de sa banca de Benjalisa. Alors là maintenant, la question adressée au ministre Agatpal, bien sûr, il n'est pas pour dire qu'il me permet une enquête le moi-même. Donc, ça c'est le Premier ministre, le Conseil des ministres qui pour bien prendre un stand là. Mais moi, l'opinion personnelle, Jagdish, c'est que Tibizan est une enquête indépendante, l'Olamo, sa disparition de dialyse.
Oui, et surtout sa campagne de vaccination qui fait, il prend la décision envers les frontliners. Donc, quoi qu'il est essentiel, il est nécessaire. Donc, pas fin donner également priorité à ban qui est plus exposé au virus. Alors oui, c'est vrai, c'était une occasion pour nous guetter plus vivant qui est capable de faire pour éviter un drame parce que ça, ban famille là, beaucoup de familles dedans qui donc les victimes qui ne cette famille peut dire tu peux continuer à suivre la dialyse pendant plusieurs années et jamais les autres filles exposées directement un seul coup comme ça, c'est-à-dire l'attention qui braquait le achat d'équipements médicaux dans le confinement en 2020. Il y a une question de député Nagalingom au Premier ministre. Comment, par exemple, la compagnie Pack and Blister, il retenir l'attention du High Power de High Level Committee, donc également, qui bonne disposition peut prendre pour remboursement en cas de bon équipement en panne. Donc, le contact tracing, tout ça, il fait partie d'autres questions qui peuvent bien répondre au Parlement. Donc, ce matin, d'abord par le Premier ministre, également, le ministre, pour répondre aux questions sur la crise sanitaire.
Vous êtes capable de continuer à suivre les travaux parlementaires, nos pages Facebook, Défi Média. Et à 13h, j'étais en rendez-vous avec Dushila Mansingh pour le journal complet de la mi-journée. Merci, à bientôt.